Dr. Jonathan Wright is a Harvard University and University of Michigan Medical School graduate. He was also awarded an honorary naturopathic degree by Bastyr University in 1993. He's well known as a pioneer in the research and application of effective natural treatments for health problems not requiring surgery. He founded the Tahoma Clinic in Washington State in 1973. Using an accumulation of medical articles concerning diet, vitamins, minerals, botanicals, and other natural substances, he developed successful natural treatment protocols that have helped thousands of patients. Since 1983, he has taught seminars and professional conferences about his methods. Early in the 1980s, he was the first to prescribe comprehensive hormone replacement therapy using hormones identical to those found naturally in young humans. His therapy, bioidentical hormone replacement therapy, is now used nationwide by millions. He's internationally known for his 29 medical articles and 13 books, selling over 1.5 million copies, with 2 texts achieving best-selling status. In 1996, he has written a popular monthly newsletter emphasizing nutritional medicine. And in April of 2012, he was inducted into the Orthomolecular Hall of Fame and honored for his contributions to the field of natural medicine. A full list of publications, honors, and awards appears in Dr. Wright's curriculum vitae found on www.tahomaclinic.com. Please give a warm Academy welcome to Dr. Wright.
Well, thank you, and sorry you had to go through all that. Yeah. Okay, and thank you for being here, and I hope to get this done in the time allowed. You can all see what the title is, so I won't read that to you. I actually pressed the right button. How do you like that? Okay. Yeah, just lots of things you can see in a physical exam that'll tell us some of the things that matter, and sometimes even tell us what needs to be done at the same time. So I'm not going to quote the whole PowerPoint there. I guess we're just here, starting at the top, as it were, unless we're standing on our heads, of course. If we happen to be having hair loss and we happen to be premenopausal in a lady, then the large majority of the time, that poor woman is getting hypochlorhydric already. Now, you may or may not be aware of the Mayo Clinic study that pumped out 3,000 to 4,000 stomachs on men and women of all ages. And what they found was that by the time everybody gets to be 50, it was slightly more than half of the women and slightly less than half of the men, nature's sexist again, whose stomach acid was starting to decline. And what Mayo Clinic pointed out is that that stomach acid was not replaced. The ones who didn't replace it, as they were advised to do to help digest breakfast, lunch, and dinner, were more likely to die sooner, just simply because of inadvertent malnutrition. So it's something that happens with time, like menopause, andropause. So I wrote a long article about it in my newsletter called Gastropause, giving all this background, because we're all going to have that happen to us. And here's all the consequences of it. Amino acids low. Sometimes hidden gluten sensitivity can always aggravate assimilation. I think we all know that. And then it can lead to low iron and so on. So anyway, hair loss in premenopausal women. Now, it could also be birth control pills, as it says there. And so if they're taking birth control pills and they happen to lose hair, B6 or P5P, and it also does say pregnancy, and those are usually relatively safe in pregnant ladies. So low iron, sometimes weak thyroid, sometimes weak DHEA for hair loss in postmenopausal women. And there's a summary of the whole thing, and I don't know if you want to be bored with me reading it to you again. I'm sorry, do folks have access to these so-called PowerPoints through IAOMT? Yes. Good. So I won't read everything to you. Now, for us guys, those suggestions simply don't work in male pattern baldness. It's also often said to be, oh, it's hereditary, it runs in your family. But if you then look at the legs and see not enough leg hair, you might want to check testosterone and DHEA, see if that has anything to do with it. As it does say, testosterone is more powerful hair grower, but just ask some bald men about that, how it worked for them. It works for some of us. Now, so-called dull, lifeless hair, often fatty acid deficiency, B complex needed. So the fatty acids are in the fish oil, aren't they? And we don't have to supplement for the rest of our lives. It's the same quantity usually. We just taper it down, and if it comes back, go back up again. Now, funny thing, particularly kids, if they say their hair hurts when their hair's brushed, they're usually vitamin D insufficient. And you get them up there to a good level of vitamin D for those kids, and what do you know? It says 400 to 1,000, and adults 3,000 to 4,000. And the hurting scalp when you brush it goes. Okay, a lot of reasons for chronic itchy scalp. Overly alkaline. Now, did you know that all cavemen and cave ladies had acid scalps? They didn't use shampoo. They didn't use anything that would alkalinize their hair, which is why a physician from Vermont named D.C. Jarvis, who has a terrific book out that if you haven't heard of it or seen it, you can still get paperback copies cheap, used online. It's called Vermont Folk Medicine. I can recommend that highly to everybody. Jarvis spent his whole career, and he taught us a lot, or actually his patients taught him a lot, that tells us all about what we can do for us. Now, why'd I bring that up? Because Jarvis says cavemen and cave ladies had acid scalps. Why do we have such itchy scalps these days? Because we all use shampoos and soaps, and that's alkaline. So what Jarvis recommended, and I've passed it along, and people says it really is helpful, is after we take a shower, and yeah, you got to use soap and shampoo and stuff, but then he says, give it a good rinse, and then close your eyes, vinegar. He says it's going to keep your scalp a lot healthier, thank you, if you do that. So my wife and I have been doing that ever since we read about Dr. Jarvis, and sure enough, it does feel better. Not right while you're putting the vinegar on, of course, but after you've gone rubbed off most of that vinegar. So there's D.C. Jarvis Folk Medicine there. You can find it on one of the PowerPoints. Why are the damn things called PowerPoints? Are they powerful? I don't know. Okay, so dandruff, there's a lot of things to do about. Eliminating sugar and refined carbs usually helps. And then we've got the fatty acids, the B6 and the selenium, and that'll usually at least settle down the dandruff. Some people say it goes away completely, but at least it settles down. Now, poor mom, if her nursing infant has dandruff, then she has to eliminate the sugar, refined carbs, et cetera, et cetera. And if it's really severe, it's called cradle cap, and those things listed on the PowerPoints, or the PowerPoint I should say, the biotin, the flaxseed oil, rubbing into the scalp can help. I don't see too many bald babies, but occasionally. Now, if we get along to skin, rosacea. Now, this is something that we're still, in conventional medicine, giving people antibiotics for. And you give them the antibiotics, and it kills the germs in the stomach. It kills the germs in the stomach. They give off the toxin. It makes your face red. Okay, somebody comes in my clinic, or our clinic, I should say. My wife owns it. I look at their face, and they're starting to get rosacea. That person has got gastric hypochlorhydria to a small or a larger degree. No question. You see somebody with rosacea, they don't have enough acid in their tummy because there's not enough acid to kill the germs that are making the rosacea. So if you want to cure rosacea, it's real simple. Check for stomach acid if you want to, or just start building up the stomach acid till the rosacea goes away. No kidding. This is a key sign that there isn't enough acid in that stomach to digest breakfast, lunch, and dinner adequately. That's what rosacea is. And, you know, when the last president got himself elected, all the newspapers had to tell everybody that Donald Trump has rosacea. So we sent an email to his doctor. Somehow we found that. Told him, hey, this man has low stomach acid. We never got an answer back. And the reason that's kind of important to know, especially if you're a politician, is the same cells that make acid make intrinsic factor, which gloms onto vitamin B12 and bring it into your body. So if you can't make acid, you can't absorb B12 from your food, can you? And politicians need lots of B12. We all know that. Yeah, maybe they'll think smarter or something if they get lots of B12. Okay, so hypochlorhydria is very common. Test for that. If you don't know how to test for that, I can cover that later on. But it is a very common thing. And it's a good idea to be testing for it in a variety of ways. It's not just all one test. You can use a variety of things to guess. For example, one of the simplest, you've all seen the hair mineral analysis where you turn in a piece of hair and you get back the levels of all the minerals. And if it happens to be an adult person and the majority of the minerals are low, that person is usually hypochlorhydric because they're just not separating out all the minerals from the food, not enough acid in their stomachs to do that, and so they get several of the essential minerals are low. Okay, then hydrochloric acid, pepsin with meals, if hypochlorhydric, goes way back. Mayo Clinic published a big study on that in 1931, no kidding. B12 and folate have to go into IM. Sorry about that, but if your intrinsic factor isn't being made in your stomach because the stomach's not working so well anymore, then you got to take B12 injections. Swallowing it will do very little good because once the stomach acid starts to decline, the so-called intrinsic factor declines too because the same cells that make the acid make the intrinsic factor, so they don't make either one. So that's why so many people over 60, 70, and so forth, need B12 shots to be healthy. They don't even know it. And what is so silly, in my opinion, I just think is really, really silly, is particularly in older people, measuring their B12 levels. Why? Because most of them are low. So why measure them? Well, we've got to have some evidence, don't we? Yeah, sure. It's called the body treatment trial. So what I have people do, since nobody ever died of a B12 shot that I know about, or overdosed either, oh yes, you're 76, aren't you, ma'am? I want you to give yourself a B12 shot every day for a week and see if you feel better. And if you don't, forget it after that. But if you do, then I want you to go back to this, back off one. And anyway, find out how many days a week your body needs B12. Your body will tell you. It's one of the things I like about it. You don't need a blood test. You don't need a hair test, nothing. You just try it on yourself. Nobody ever died of it. And over, the older people will say, yeah, I took it every day for a week, and then I figured out I need it every day for a week, but my husband over here, he only needs it 3 times a week to feel good. But it does have to be injected. Swallowing it won't do any blinking good because the intrinsic factor isn't being made anymore to grab it and bring it into the body, which is why there's more B12 shots given in senior centers than anywhere else in the country. Okay, and of course, one of the things that can cause hypochlorhydria is not just getting older. Mayo Clinic said by the time we're all 50, half of us has this condition. But Helicobacter pylori, that definitely can cause hypochlorhydria in younger people. Okay, so what about acne? Let's see. Food allergies can lead to that. We got to get rid of the sugar and refined carbs. Foods containing nutrients there, as you can see. And oddly enough, after you do all those things, zinc is usually additionally helpful. So even teenage acne will get better, not just adults. Okay, what did I do wrong? There we go. Oops, I thought I did that. And there's some of the supplemental items that help acne after you've done after you've had the folks do the things on the last PowerPoint. I don't know why they're called slides anymore. They don't go sliding back and forth. That's what they got named that for. Okay, now oddly enough, in some cases, elimination of fluoridated water consumption decreases or eliminates acne. Now, as you know, since you're members of IAOMT, fluoridation in water ought to be outlawed. It just does all kinds of bad stuff for folks, not just acne. But can anybody tell me how fluoridated water got started? What's that? No, sir. The president of Alcoa Aluminum. Nope, not even Bethlehem, Pennsylvania. The president of Alcoa Aluminum was near Portland, north of the city, across the river. And they were doing some kind of chemistry that promoted toxins. They really were. And those toxins included fluoride. Funniest darn things. So what happened? Why, the president of Alcoa Aluminum, I am not kidding you at all, was appointed director of some government partner back in Washington, D.C., Yeah. Whence he started ordering fluoridation around the country so that Alcoa could sell the fluoride. Yeah, look it up. That's how it got started, was because Alcoa needed to make big bucks on their toxic waste, which is what the fluoridation is. And you can look that one up anytime you want to online. Okay, premenopausal acne frequently gets better with B6. Teenage acne, well, here we are with eliminate sugar, refined carbs, and so forth. And the other thing, zinc is always good for acne, essential fatty acids. And if you like eating pumpkin seeds, they've got all of that. Didn't I do that already? I guess not. High dose vitamin A. Now, how can you tell if you're taking vitamin A too much for certain? Okay, here's how. Some university rounded up a whole bunch of college students, and all the young men took 500,000 units of vitamin A a day. And all the young women took 400,000 units of vitamin A a day. I know that's sexist and gender specific, but that's what they did. Okay, so they did that for a while, and then out of the whole several thousand students, about half a dozen of them started getting headaches. So they told them, back down your vitamin A, and the headaches went away. It works every time. When you're taking too much vitamin A, you'll get a headache if it's too much for you. And not everybody in that whole group got headaches. So you can actually have people, if you want to, and if you need to for health, increase their vitamin A quite a bit, as long as you warn them that if you start getting a headache, it's too much for you. That's all it takes. And this big giant study I was telling you about, there were only 3 or 4 who had that problem. Yeah, there's some university with all kinds of young men and young women. Okay, so vitamin A, selenium, yes, that's helpful. Niacinamide with vitamin C, and by the way, the compounding pharmacies do put this together now, niacinamide with vitamin C that can be rubbed in up here, and that does help with acne. And so does azelaic acid, topical. Here's our high doses again, but of course, if she might get pregnant, you don't want that high dose of vitamin A, do you? Difficult cases, there's that 500,000, 4,000. And the one sign of too much vitamin A that we can count on is headache from increased cerebrospinal fluid pressure, which is what the excess of vitamin A for any one person will do to us. Okay, now we have this thing called atopic dermatitis or eczema. A lot of things to do there. Check for allergies. They usually have allergies. Check for hypochlorhydria and vitamin D, and I'm not kidding you, even in teenagers, some of them, it's not very many, but some of them, if they're difficult cases particularly, have hypochlorhydria, and they certainly need that extra vitamin A. Extra vitamin D, I said that wrong. Okay, zinc and copper helps, particularly for men with the atopic dermatitis and eczema. I don't know why it's not particularly for women, but that's what the experts say. I thought an expert when I was a kid was somebody who used to be a pert. And that's how they became an expert. But I guess not. And I was in grade school at the time, so I didn't know any better. Okay, then we have the lactobacillus oolong-T, vitamin C, and vitamin B12. Now, there's a fairly recent research report when these so-called PowerPoints were to get put together. It was 3 or 4 years ago. There it is at the bottom. Oh no, that's 2020, my mistake. L-histidine significantly reduces atopic dermatitis and eczema. And there's a citation if you want to look it up there, June 2020. Yeah, just plain old L-histidine. So I haven't got much experience with that because we're just into 2021, but it has worked in a few cases anyway, and the others just not to take it. What can I say? Now, I know we've all heard about vitiligo, and we mostly know that hidden gluten sensitivity can lead to vitiligo quite a lot. So what one needs to do is, if you want to check for gluten sensitivity, please do. Some people are hard to convince, so you can run a test for gluten sensitivity, and that might convince them. And so you get off that gluten, and then here's all the supplements that can help the vitiligo go away after the gluten is gone. So, but unfortunately, getting vitiligo is a fairly good sign of a gluten problem. Seborrheic dermatitis. We do topical treatment with a compounded cream, which happens to have vitamin B6 in it, as it says there. and oddly enough, 5 milligrams of lithium in with the B6. Now, that is a combination that I passed along to compounding pharmacists who'd been in business for a long time. So she owns the place, put it all together. And since we did that, we found it works in 95% of everybody, putting together the vitamin B6 and lithium in those two quantities. A lot less lithium, and it's all topical. And my goodness, does it work on seborrheic dermatitis most of the time. You betcha. There was a hospital in Houston where the docs decided everybody who's going to get a skin tag is going to get a glucose tolerance test. No kidding. And what they found that almost all of the people with skin tags had prediabetes, poor glucose tolerance test. Yeah, so if you see skin tags, those people are on the road to type 2 diabetes almost always. So if you don't see them, you're happier, or at least they're happier. Large majority of instances, skin tags, insulin resistance, and potential type 2 diabetes. And there's something called a Kraft prediabetes test. Joseph Kraft, he was somewhere in the Middle West, and he put together this test. It's a very, very, very good one for insulin resistance. I think you can look it up online, Kraft prediabetes, if you don't know about it already. And 80% of the skin tag people are positive for prediabetes. So you can not test them and just get them off of what they need to get off of, too. Namely sugar, refined flour, you know the story. Okay, now if they're bruising easily, it can be due to not enough vitamin K and flavonoids, which are things that help against bruising. It can be, doesn't have to be, but it usually is, and nobody ever got hurt by trying vitamin K and flavonoids that I know about. Okay, there's also probiotics because vitamin K is supposed to be made by so-called friendly bacteria. I don't know why they're called friendly. I wouldn't be friendly to me if I put all kinds of junk food down there, you know? So why are they called friendly bacteria? Anyway, vitamin K supplement 50 milligrams. And those two things, the vitamin K and, boosting your flavonoid levels. And usually your easy bruising goes away in a period of time. There are supplements that are high in flavonoids that are on the shelf in all the health food stores. You can see right there, bilberry, ginkgo, hawthorn. You can use that too. Okay, actinic keratoses, we've probably all seen those in the course of a career, and there are things that actually prevent them. And they're listed. Retinoic acid rubbed in topically where they like to break out. Oral amounts of lycopene, ECGC, proanthocyanins, resveratrol. Resveratrol is good in a lot of situations. And you can see the last list, olive oil through vitamin D. But that really does help. Another thing for actinic keratoses, solacidine glycosides. Now, there's a book out there called The Eggplant Cancer Cure, no kidding, and by Bill Chem. And he explains about what solacidine glycosides are all about. There's a preparation called BEC5. There's another one called Curaderm. And by the way, folks, you haven't heard this because of one of our favorite federal agencies who will not allow it into the country. Curaderm cures skin cancer every time I've had somebody try it. But you can't get it legally, according to FDA. There are places where it's available in these United States, and I'm not going to give them to you because if somebody sees this, they can go arrest them. But there is Curaderm available. And it's just incidentally Bill Chem who put that together. He lives in Vanuatu, so you could always put Vanuatu in your search engine and see if you can find the man, Bill Chem. And there's his book, The Eggplant Cancer Cure. And it's not the eggplants curing the cancer, it's the solacidine glycosides in the eggplant that killed the cancer. And again, there's his book. Okay, now brown spots on the skin. This is one of my least favorite, is seeing brown spots on some people. Do you know why? Well, among other things, it very likely means prediabetes or diabetes. But the big deal for somebody who has brown spots is this person's body, male or female, cannot internally synthesized niacinamide. And if you hadn't heard this, a Professor Oxenkrug from New York City wrote us a whole chapter in a book about this, and he tells us that 2/3 the population, 2/3, when they're born and continuing from there until they get older and it decreases some, 2/3 the population can metabolize their own niacinamide out of tryptophan, and they don't need to take the blanket stuff because their bodies can metabolize it out of tryptophan. So if they're digesting their amino acids properly, okay, they got a tryptophan to niacinamide pathway. But what Oxenkrug also proved, he's got some very good publications on this, and OXENKRUG is a good name to remember to look up online. What he also proved is 1/3 the population is genetically incapable of making niacinamide, genetically incapable. So their bodies can't synthesize it at all. And unfortunately, that 1/3 is mostly people who come from genetic heritage of type 2 diabetes. I'm sorry for those people, but it's usually part of the genetic heritage is you can't synthesize your own niacinamide. Now, when you can't synthesize your own niacinamide, you get brown spots. So it's one of the first things that says, aha, this person hasn't been making niacinamide internally like they should, is getting brown spots. Okay, they fade very slowly over time, and I do mean slowly over time. If you got a bad case of brown spots, they're going to be about halfway faded in 2 or 3 years. It does take that long. But what you're also doing with that niacinamide, I didn't put it on this PowerPoint. Anyway, the brown spots needs lifelong niacinamide supplementation because of inadequate internal tryptophan niacinamide metabolism. Why would they need that niacinamide for the rest of their lives? Well, funny thing, but niacinamide prevents osteoarthritis. And if we happen to have osteoarthritis and we follow the work of Dr. William Kaufman, and we have that person take 3,000 milligrams of niacinamide a day, Kaufman wrote us a book on all this. It was published in 1949. It was called The Common Form of Joint Dysfunction. And out of 554 people with osteoarthritis, 550 of them were totally pain-free within 4 months. And only a few of them it didn't work on. And this is very safe to do because, as Kaufman pointed out, if any of us take too much niacinamide for us, never mind the next person, if any of us take too much niacinamide for us, we will get low-grade nausea. And if we don't pay any attention to that, we'll start barfing. I told one engineer about that, and he says, I'm going to see how much niacinamide I can take, because he had a bad case of osteoarthritis. So he says, I got up to the barfing point, which, as Dr. Kaufman told us, is usually in the neighborhood of 3 grams a day. But I'm an engineer. I wanted to see what would happen if I still took more. Well, that's what he did. He came back on another visit and said, I was barfing in the toilet when I took that much. So anyway, niacinamide, it'll help remove brown spots. But the brown spots are the signal that your body can't make niacinamide. And so niacinamide does so many other things that are good for us. It reduces osteoarthritis. It reduces risk of cognitive decline. It absolutely does if we need it and we don't make it internally. How does it reduce risk of cognitive decline? Well, that was done by some researchers at UC Irvine. And what they do, they genetically engineered some poor little rats and mice. And if I were the little rat, I would have bitten that researcher for doing this to me. They genetically engineered them to get identical to human Alzheimer's. I'm not kidding at all. So when these poor little rats and mice were showing signs of human Alzheimer's, how do you do that if you're a rat and a mouse? Well, maybe they were politicians, I'm sorry. But how they were showing signs is they could no longer find lunch. And you know, that's what rats and mice do for a living in universities, is they look for lunch. And they couldn't make their way to find a lunch anymore. So what'd they do? They had all these rats taking the mouse equivalent. They adjusted for weight, of course. The mouse equivalent of a total of 3 grams of niacinamide, which, by the way, for anybody with osteoarthritis is the goal. It gets rid of it for the large majority. Takes a month before you notice anything happening, but by the 3rd or 4th month, wow, where'd my osteoarthritis go? So anyway, with that niacinamide and the rats, they then let those poor rats do their rat thing, and when they couldn't find lunch anymore, which is what happens if your rat or mouse brain isn't working, you can't find lunch anymore, they biopsy their little brains. Looks just like human Alzheimer's. Again, that was the time for the mouse or rat to bite the researcher again and say, what'd you do this to me for anyway? So after they biopsied, they then put these rats on the equivalent in rat weight of 3,000 milligrams in human weight, and they regained the ability to run the maze. And when they rebiopsied their little rat brains, the tau protein, the beta amyloid, and neurofibrillary tangle were significantly decreased. And that works not just for rats and mice. If you've got somebody with early Alzheimer's pre-dementia, try it out. And if they don't barf, have them keep trying it. And some of that's going to clear. I'm not going to guarantee all of it's going to clear, but a lot of it's going to clear. Okay. And rule out any risk of skin cancer when you see a brown spot. It could be a pretty much skin cancer. If it doesn't look like one, just a regular old brown spot, fine. But you might need to find if it is in some people. Okay, that's just a summary of what I was telling you there. Adequate internal synthesis prevents brown spots, and there's Dr. Oxenkrug, chapter 8 of this book called Tryptophan Metabolism. Yeah, 1/3 of us cannot make our own niacinamide, and we're much more likely, if we can't make our own, to die sooner, because niacinamide has so many activities. Here's one I really like. Researchers back in New York City found that niacinamide gets every cell in the body to make more ATP. No kidding, it's an energizer. But it's not a hyper-energizer. It's just that people who are tired all the time and they need niacinamide, they take that, and they're definitely a lot better. They're not perfect, nobody's perfect, but they're a lot better than they were before. And while I'm at it, another thing that niacinamide really helps to do, I'll tell you 2 other things, it's not on this PowerPoint, it helps people to sleep. People who can't synthesize their own niacinamide sometimes have a hell of a time sleeping. And so if they just get onto their niacinamide in those doses of up to 3 grams a day if there's no nausea, and take some of it at night, of course. And by the way, somebody put out time-release niacinamide tablets and pills too. So those you can take at nighttime, and you don't necessarily have to get up at night to take, later at night to take more niacinamide. But it absolutely does work. I've heard this from a lot of people. And then here's what I hear from the husbands of women who need niacinamide to sleep. She's not near as anxious as she used to be. She's not as anxious and jittery. And what I hear from the wives of men who need niacinamide, he's not so damn grumpy anymore after he's been taking his niacinamide. So apparently it has some other good activities too. Anti-anxiety, anti-grumpy, depending on the gender. Okay, am I going to hit the right button here? I hope so. Nope, I hit the wrong button. Maybe it's over here. Did I turn the whole damn thing off, ma'am? How'd this get into 3 slides? Okay, if there's somebody out there who can educate me on how to get to the next slide and not keep making this one going up and down. There's a picture of a computer, is that what you mean? Oh, go to the computer, I'm sorry. Slideshow. Okay. Now, technologically, I am not very educated at all, so if somebody wants to come up here and hit the right button, please do. I don't see anything that says slideshow. I'm sorry, folks. Top row, 3rd from the right. That's up here. Thank you very much, sir. Now, I don't want to play from the start. Play from current slide. I think we did this already, but I wish we'd all quit calling them slides. They don't slide around anymore. Used to, you'd have to put on this machine and it slid them in, but not anymore. Now let's see if we can get somewhere here. Okay, there's a research article on the niacinamide insufficiency in skin, and not only the brown spots, hyperpigmented spots, but yellowing skin, wrinkly skin, red blotchiness. Now remember, any supplement that's incapable of energizing every ATP in every cell in the body has got to be capable of a lot of stuff, doesn't it? Just simply by energizing whatever it is. Yeah, so I'm not surprised when it can do all this kind of stuff, and that's from 2004. Okay, we'll try to move on to ears here. That one's pretty simple. Anytime I see somebody with too much earwax, you eating any fish? You taking any fish oil? What about your essential fatty acid consumption? You know, if you do that for a while and then clean out your ears, the earwax won't come back near as much. And not that anybody ever got killed with earwax, it's just simply body language again. It's telling us that we need more essential fatty acids. Okay, so we got fish oil, GLA, and of course, once you get the response you want, you titrate down and see if it stays that way and find out how much our own individual bodies need to not get earwax. Now, of course, if you eat plenty of fatty, oily foods, you probably don't need to take any supplements. But if you don't, no fish, nothing like that, then you're probably going to get the earwax. Okay, somebody actually did a publication on these cracks behind the ears back here. They actually are a sign of health problems down the road, no kidding. But you can get rid of those cracks by using zinc, 30 milligrams twice a day, offset with copper. And then as this all gets better, you can try tapering down and see if it stays that way. But seriously, they are a sign of zinc insufficiency for that particular individual. Okay, now kids' ears get redness intermittently. Yeah, those are allergic kids. You got to find out what they're allergic to and get it out of there, and they'll quit getting redness. Okay, recurrent infections in little kids, food allergies, get rid of the sugar and refined carbs. How often do we hear that? And I know I have to tell people I'm working with that all the time. But very fortunately, people are doing much more reading on their own these days, particularly the internet. And a lot of the people that come in to see me, they've all got rid of the sugar and refined carbs 10 years ago. Good for them. Okay. And then zinc and copper helps that too. And varying doses depending on the age of the child. And remember, if they get a headache, it's too much vitamin A no matter what age they are. So 25,000 to 50,000 IU for older kids, back off if that headache happens. Now, I'm not quite sure why it says unless practicing in California. Must be it's illegal there or something. There are a lot of things that politicians make illegal that are good for us, as you know. But they can't be sold at a high price and paid a lot of money to the FDA, can they? No. Okay. Now, that crease there can also suggest, I'm not kidding you, this is from somebody's research, carotid intimal thickness with a predictive value of 60 to 80% just because you got a crease in your earlobe? Ooh, so I suppose you could scan your carotids to find that out. But I think it'd be better just to stick with the crease in the earlobe and wait till that fades away with sufficient of the things that are suggested on there. Okay. You might want to run a cardiovascular panel to see if you find any other abnormalities as listed on there. Chances are you will find at least one or two. Hearing loss. Now this one's an easy one. Professor Dennis Troon taught us all this. He's still at the University of Oregon. And you know what the reason why they call them universalities? Because they know everything. Yeah. So anyway, he taught us this. He found that a large proportion of people who are losing hearing, even if they were older, if he checked them for serum aldosterone, they were low. Okay. He'd also previously found that in mice and rats. And again, these are real rats and mice, not politicians. And what he had done with the rats and mice is, here, have some aldosterone, ratsies and miceies. And they did. And the large majority of them recovered their hearing. Okay, so I read Troon's stuff, and we started checking people with poor hearing for low aldosterone. And for 3 years, we could actually get aldosterone shipped into the United States from Vancouver, British Columbia. And it helped a lot of people with their hearing. But guess what? Guess which federal agency made it illegal? we can all guess that one. So now if you want aldosterone for your hearing, you have to get, with your masquerade, I'm sure, on board an airplane and go to Vancouver, BC to get your aldosterone. It's illegal to ship it here. That's according to one of our least favorite federal agencies. You can't ship it here. So I do check everybody for hearing loss to see if they need it, and I tell them, well, this is the situation. If you want to go up there, you can get it. Oh, and I've worked with a lot of people who have done so, and yes, it does improve their hearing. They just take the aldosterone. Available in Canada, unfortunately. And sometimes that pharmacy mentioned on the right, with whom I have no financial connection, I'm just grateful that they'll do it for people. Sometimes that pharmacy, they can fill U.S. prescriptions. It depends on which state, because states have different regulations. So some states they can ship it to, and other states they can. So I suppose you could always develop a relative who lives in a state they can ship it to, and then they can reship it to you. Okay, we all know about ringing in the ears. We've heard a lot about it. I'm going to start at the bottom because a lot of those people with ringing in the ears have prediabetes. And that crafty prediabetes test will tell you if you think it's needed. It'll tell you for sure if you do or don't. And then if you do everything you can to settle down insulin resistance, we all know the story, diet, et cetera, exercise, supplements. Funny thing that the genetics can get better, and then there are those supplements on that list that also can help us with the tinnitus getting better. This is mostly little kids, but food allergies and refined sugar and carbs, that helps not to get them in the first place. And then the other things listed, zinc, vitamin A, vitamin C, those will all take the recurrent infections away. At least that's what the parents of the kids who get brought in for that tell me. It almost always goes away. Okay, moving on to eyes, chronic red itchy eyes, chronic allergy, low-grade infection. Unfortunately for some of us, if we use eardrops that contain steroids, yes, it does increase our risk of cataract, and who needs that? So, okay, explore which with compounding pharmacies, eye drops containing vitamin A and C, which strengthen the surface tissues of the eye. They really do. The compounding pharmacy in our area can't do it anymore because of state regulations, but they put together vitamin A and C in eye drops for people with chronic red itchy eyes, and it works really, really well. So I'm hoping that if you have a compounding pharmacy you work with, they can put it together, but our local Washington State compounding pharmacy, oh my, that's been declared illegal by the State Board of Health, of course. Okay, and there's both allergic and viral conjunctivitis. If you have to have one or the other, best thing to have is the allergy, and you just quit eating your allergies and it goes away. But there are these other things. The A and the C eye drops as noted on there, and then so-called angular conjunctivitis, pyridoxal phosphate, just swallowed. That helps. You don't need it in a drop or anything. Now, the vitamin A and C eye drops have to be put together by a compounding pharmacy. It's illegal for somebody to sell them who isn't a compounding pharmacy. You know, we live in a not medically free country, you know that. And there's a lot of other things that aren't free here either. Okay, so anyway, it is hyperosmolar. So you have to reduce the vitamin C sometimes because it'll sting too much, but that's unusual. And the compounding pharmacies who do it usually know what proportions are needed. Gets rid of any virus. There is a vitamin A and C eye drops, which is probably why it got illegalized in our state, because it gets rid of any virus in the eyes. Completely controls nearly all allergic conjunctivitis, usually is not effective against bacteria. It's the A and C eye drops that are effective against viruses. So if you want to go after bacteria in your eyeballs, try some colloidal silver. Doesn't hurt a darn thing, and it does kill bacteria. There, down at the bottom, nanoparticulate silver. Dry eyes. I don't know why. It's sexist and unfair and unbalanced, but more women get dry eyes than men. Who knows why? Do check the testosterone levels. Every woman I've worked with, which is probably over the years about 20 or 25, who's had dry eyes, every one of them if she puts a little dab of testosterone into those eyes, which are drive on top of the eyelid, she's much better within a few weeks. Where did I learn that from? Harvard University research, no kidding. They did a big deal on researching dry eyes for women, and they found it was due to a lack of testosterone. Now, just as another thing that's related, the meibomian glands, you know which those are, that make the water in the eyes, they secrete there. They're totally testosterone dependent. And so that's why there's many more women with dry eyes than dry men, and than there are men with dry eyes, because those two glands are totally testosterone dependent, one here, one there. So they just need a little dabby of testosterone. Sometimes I'll tell a woman, hey, you need testosterone. She'll say, excuse me, no, I don't. And I'll say, ma'am, if your muscles aren't as robust as they were when you were somewhat younger, you probably do need that testosterone for your muscles. Oh, my muscles are just fine. Okay, then you just put a little teeny dab here and a little teeny dab there, and it comes from Harvard. That perks some people up. Didn't perk me up when I was there, but it does perk some people up. And sure enough, it does get rid of dry eyes. Yep. And there's our article about it right there. Goes way back, 2002. Still works, though. Okay, now if you're getting a cataract, I hope every one of us looks in people's eyes when we're doing a physical exam to see if we see any early signs of a cataract. Why do I hope that? Because regular ophthalmologists do not tell people when they've got, I'm yelling, yes, do not tell people when they have an early cataract. And I asked an ophthalmologist once who I knew a patient had seen, and he hadn't told her that she had a cataract. I said, why don't you tell people if they have an early cataract? Oh, I'm not going to do surgery for 20 years, so why should we bother them? Oh, come on. Now, what that particular eye doctor didn't know. 20 or 30 years ago, a Dr. Babyshev came up with a drop, an eye drop. You drip it onto your early cataract, and the early cataract just gradually fades. And they put a very ingenious name on the box that contains the bottles of eye drops. It's CAN-C. You can see if you use this stuff. But they couldn't advertise it, so they put it into the title, CAN-C eye drops. They're available online. Our Jehovah dispensary sells them, and they certainly do, because we do see enough people who are in the cataract age range. And nearly everybody says it took a while, but my vision got slowly, creepily better. And now it's back to where it belongs. Just these CAN-C eye drops. Okay, now there's another thing that one might need to inhibit, and that's that aldose reductase stuff, quercetin. So if you happen to be possibly diabetic related, probably a good idea to use quercetin for many, many reasons. We all know that. And if we don't have any history of type 2 diabetes there, I'll encourage people to make sure to get that Kraft pre-diabetes test. Now, there's something, of all things, I can hardly pronounce it, hachimijiogan. It's an herbal complex from Chinese medicine. Imagine that. They knew something back then. It's got all those ingredients. I'm not going to bore you with reading all of them. And there is a book here, 2005 book, Mosby's Dictionary of Complementary and Alternative Medicine. You can still find that online in a used copy. And it tells you about this unpronounceable stuff, hachimijiogan. It's a bunch of Chinese botanicals, and yes, it does help to reverse cataracts. I have not looked online for hachimijiogan, though. Seems that our local compounding pharmacy keeps them in stock, so I just send them over there. Okay, now there's other things besides that. As you can see, the N-acetylcarnosine eye drops are toward the bottom of the page. Then we got vitamin B12, zinc, selenium, and vitamin C, which slows progression. Bilberry, and vitamin A, all on the slide. But you really can do a lot. Now, again, I asked the ophthalmologist when I ran into him, you know, that person, when he came into my office, I saw an early cataract. Why didn't you tell him? Oh, it's not going to need surgery for 20 years. That is, unfortunately, a typical response from ophthalmologists. So that's what I don't tell people. Okay, now years ago, the PDR told us that a combination of choline and inositol and methionine would reduce floaters in the eye. And you know what? That was indeed years ago. So I've had lots of experience with telling people who say, I'm getting those little early floaters and they're telling me nothing I can do about it. I tell them, go get the choline and inositol and methionine, as this book tells us. There is a combination product listed in the PDR, by the way, but it's cheaper to just go get this stuff, choline, inositol, methionine. Go get that all in your health food store. It's cheaper than get it from the compounding pharmacy. It says there are similar products available over the counter, so a person doesn't have to put up with floaters, unless they're an eye doctor where they think they have to put up with floaters. So, okay, glaucoma, first thing to do is to check for weak adrenals. Where'd I get that? From Emmanuel Josephson's book in 1937. Yeah, I got a lot of old books. I'm sorry about that. But they're good ones. I trashed the ones that don't do any good. But they're good books. And just for the record, Tahoma Clinic has over 250,000 on-paper and PDF studies in our archives. So the clinic pays a researcher now to go find all the good research that we can apply to patients. So that list is growing of all these studies that tell us what we can do for folks with natural substances. Okay, so there's glaucoma and its medical treatment. I don't know if you can still find it. It was published in 1937. Normalizing intraocular pressure in approximately 50% with something called adrenal cortical extract, which FDA made it later in the 1970s. Isn't that lovely of them? You can no longer get adrenal cortical extract officially because of the FDA. They're protecting our health, aren't they? Yeah, huh? And particularly the health of the patent medicine manufacturers. Okay, but oddly enough, if you go online, and don't spread this word too far, and you look up adrenal cortical extract, you'll see there's a small company in Arizona that makes the stuff too, and it can be bought online from them. And why would you want to do that? Well, I would if I were a person with adrenal weakness. Now, it's the only thing to do for adrenal weakness, but it really is a good start. Okay, now when he could get the IV stuff before the FDA outlawed it, he documented 50% of the people who used those IVs got better. And there are also the sublingual drops, which are available online that I just mentioned. And the company that makes them says they're 85 to 90% effective as the IVs. Now, I've had occasion to mention this to people, and there was one person that didn't help much, but it did help everybody else. They just had to go online and buy the stuff, but no big deal. Okay. Now, there's a full spectrum adrenal cortical extract, as it says in the bottom, with all 28 cortex fractions except for adrenaline, and that comes from New Zealand or Australia. So one can get it that way too. But anyway, glaucoma is not something that we have to take patent medicines for or put up with. Now, there's something that's not on this PowerPoint, and that is a much more recent publication just 3 or 4 years ago, maybe it was 5. They found that niacinamide slowed down glaucoma because it simply energizes every eyeball cell there is, as well as energizing all the other cells in the body. So what happens is those eyes start making more ATP, and they get better. So niacinamide will help a lot too with glaucoma. Now, Dr. Arthur Alexander Knapp, who's unfortunately no longer with us because he discovered a lot of good stuff and wrote some good books, he told us that vitamin D and calcium would slow the progression of retinitis pigmentosa. So after I got in touch with his book and started passing that word around, I don't see very many people with retinitis pigmentosa, but when they do come in and say, the eye doctor told me I've got that, I'll always ask what the eye doctor tell you to do, nothing in particular. Oh, you might want to try what Dr. Knapp told us about. And if we're having trouble with adapting to dark, bilberry, taurine, those help. Now, here's Knapp again. He documented, he was a New York City physician for what that's worth. He documented improvement with vitamin D and calcium I wouldn't let him do this to me, but his patients let him do plaster casts of their corneas. Oy vey. So he could prove that it was a problem. And then he puts everybody on calcium and vitamin D, and he does another plaster cast afterwards. And what do you know? Vitamin D and calcium and the keratoconus could be documented by these plaster casts as getting less. Okay, see somebody with red in the eyes, if they didn't just get socked in the eye or something, you got to worry about hypertension because, of course, high blood pressure might break those vessels in the eye. There's also some things, if you don't have hypertension, that can be helpful because of their vitamin K content, and that would be dark green vegetables. It's broccoli time, and that helps the blood to clot more normally, and obviously one can't do that as one is taking a Coumadin or any other anticoagulation. Now, that's one of the best signs of food allergy there is in children, is dark circles under the eyes. So if someone brings her child in, or his child, whichever, it's usually the mom's, and I see those dark circles, I'll tell her, your kid has food allergies. Some of that dark circle, if not all of it, will go. So there's a fairly simple test. It's not even a blood test. It's a poke test. You get out a drop of blood, and you can check for about 100 different food allergies should you feel like it. And that's usually preferable for the kids in getting blood drawn. Okay, some of them, their pupils don't, they dilate more than a quarter of an inch. And dairy products are the most frequent offenders. They certainly are. I don't know who got the idea that humans are identical to calves. No. Cow milk goes into calves, doesn't it? It's for them. It doesn't go into human beings. There's all kinds of other reasons why the milk of a cow does not belong in a human. It belongs in a cow. Okay, so if you happen to pull down the eyelid and you see it's pale there, those are the things you need to check. CBC, serum iron, iron binding capacity, not serum ferritin. When I was in medical school, they were doing all this serum ferritin stuff and ignoring all the others. I hope they've gotten over it. And if any of those are low, got to check several things. Hypochlorhydria, my iron isn't getting digested into me. Maybe it's gluten sensitivity. And rarely, I didn't know, but I looked in the toilet a lot. Yeah, I'm having a little bleeding with my bowel movements, but that doesn't, I don't see that real, people don't tell me they see that very often. Oh, isn't that cute? I wonder why they're rubbing noses. Okay, that there, dilated veins on the side of the nose, those are things that can lead to it. Alcoholism is a big one. Hypochlorhydria, very definitely. Vitamin B12 insufficiency, particularly B2. Now, one of the best ways there is when a person comes walking into your office is to know that they are hypochlorhydric, and as the Mayo Clinic pointed out back in 1931, once they get to be hypochlorhydric, the hydrochloric acid doesn't come back on its own. It's like your ovaries turning back on or testicles turning back on. It just doesn't happen. So if somebody walks into your office and you see red lines on their face, that's called acne rosacea. That's due to hypochlorhydria because there's enough acid to kill the bacteria that make the toxin that give you the problems with your eyes. So anyway, red lines on the face, and those can be persuaded to go away by the appropriate amount of betaine hydrochloride, which every health food store in the world has, usually between 1 and 4 capsules with a smaller meal, depends on the person, and 4 to 6 with a larger meal. And you do that, and if it doesn't hurt your tummy any, that's just fine. It shouldn't, because you could put hydrochloric acid in your stomach when you were younger. If it does hurt, that means the stomach lining is starting to deteriorate, and it's just like before menopause, most women don't say sex hurts. In fact, nearly none of them do. But after menopause, owie, it can hurt. It's because the lining has deteriorated. I didn't start out with the women here, but for those ladies, if they put some of their hormones there, the lining rebuilds back if they're using hormone replacement therapy. But getting back to this over here, and the dilated veins, again, those people need the hydrochloric acid, and the dilated veins will fade. If you don't have a gadget in your office to measure hydrochloric acid and you work with a lot of patients, it might be a handy gadget to get. I don't sell them, I'm just letting you know, but it might be useful. Okay, I've seen three kids in the last year with this crease across the end of the nose, and Doris Rapp, an MD, she taught us all that that just means allergy, particularly food allergy. So you see that? Better run an allergy test. Stuffy nose all the time. Here we come with food allergies again. Could be an infection. And those infections can sometimes be fungi. And of course, antibiotics work on bacteria, not on fungi, so you'd have to get something else going if it's that. Now, there's also another alternative. Xylitol. It sometimes helps. I don't know why. I don't recall reading why they thought it helped. But you spray the xylitol into the nose a couple times a day, and I'd say about half of everybody gets reduced stuffiness. And the other half don't, but it's not going to hurt anything, that's for sure. Okay, we've all heard of nasal polyps. Prospective controlled study, 30 patients with nasal polyps. H. pylori DNA was detected in all patients with nasal polyps. Just an H. pylori up there. Duh. There's your citation at the bottom, Archives of Medical Research. Now, what do we do about Helicobacter pylori? There's some genius physician, I believe he was from Arizona or California. He was actually a dermatologist. He put together a product called Psorizide, P-S-O-R-I-A-Z-I-D. And the reason it's not on the PowerPoint here is in case it gets into some governmental hands. I don't want to get him into trouble. But it's P-S-O-R-A-Z-I-D-E, Psorizide. His name was Stephen Smith. And what he had done is he had investigated why people who had psoriasis, which is caused by H. pylori, had learned that if they go to the Black Sea in Israel, their psoriasis gets better. So good old Stephen Smith goes to the Black Sea, gets some of the water, brings it home, and what he finds out is that there's a lot of bromide in the Black Sea. But even better than that is if you combine it with nickel. H. pylori loves nickel. It's just its favorite mineral. So it takes up the nickel, and at the same time it takes up the dibromide, the two bromide molecules with it, and those kill H. pylori. So I've been able to help a number of people with nasal polyps just by taking Dr. Smith's Psorizide, P-S-O-R-A-Z-I-D-E. It's a little hard to find. We have it at our clinic dispensary, and you don't have to be a patient to home clinic to buy it if you want to. You might be able to find it online. Sometimes you can. But it definitely gets rid of nasal polyps. Now, how does it do that? Well, it seems that the reason Dr. Smith put that together in the first place is he happened to know that H. pylori likes bromide. Or doesn't like bromide, excuse me. That's why the people go to the Dead Sea. So he just put together the molecule, nickel dibromide. It's in this little pill. Your polyps will go. Or anybody's polyps will go. Now, sometimes you can put bismuth and progesterone into a nasal spray. Your compounding pharmacist can do that. Low percentage of DMSA. And research reports that both of these things, bismuth and progesterone, kill Helicobacter. Now, the Psorizide by Dr. Stephen Smith, that kills Helicobacter. And it's nickel dibromide, so you got to check that person for bromide after it does its job, because the reason it's in there is that the bromide in the nickel dibromide kills the Helicobacter, but some of the bromide gets into our bodies too, and so if we check our bodies for bromide and we got too much, we just might want to be doing some things to chase the bromide out of the body. And what things chase the bromide out of the body? Real simple. Look at a periodic table. Here's bromide. Vertical column. Anything that's in that column will chase the other things out. Yeah. So just look at the periodic table. Now, Psorizide is nickel dibromide. And as I say, we've got that at our clinic dispensary. You might be able to get it online. So you better check for the bromine-iodine balance after treatment. And this therapy has no published research. I just know it works because I've seen it work, but that's not published. Okay, on we go down to tongues. Cracks and grooves in the tongue. Do you see those from time to time? I bet you do. When you're doing a physical exam, look at that tongue on the right, look at this less bad one on the left. Those people all need more B12, more zinc, and more copper. And if they do that over time, the tongue will be less and less groovy. And none of us want our tongues to be groovy, do we? But it definitely shows insufficiencies of certain nutrients, and it does take a few months, like I says. And those treatments can also help what's called geographic tongue. Same thing, folate, B12. And it says perhaps 1,000 micrograms daily of each. Now, sometimes it doesn't work orally because remember that the same cells that make stomach acid are supposed to make intrinsic factor, and oral B12 cannot be absorbed if the cells aren't making acid. They're not making intrinsic factor, so it just goes in one end and out the other. And as you know, just ask any nurse in a nursing home, what's the injection you give the most? Well, B12 shots. Because people in nursing homes are much more likely to be hypochlorhydric, aren't they, at that age? So they have to give them the shot. So we just teach people how to do their own. We have to reassure them several times. Nobody ever died of too many B12 shots or overdosed, nothing like that. And it's going to help this out of the other thing, and people learn how to do their own. Okay, we've all seen this. Ooh, tongue's white-coated. That's Candida, all right. Now, whoever made up that silly song called Candida, We Can Make It Together, should have titled it something else, because we don't want to make it together with Candida. We definitely don't. Candida wants to make it together with us, but not vice versa. So there's a prescription called nystatin. Now that is, oddly enough, nystatin was invented by New York for nystatin, New York State Research Labs, and they came up with an all-natural product. Imagine that. So they named it after themselves, nystatin, and of course, it's on prescription only. It wasn't to begin with, but now it's on prescription only. And it's totally natural, never hurt anybody. So I'll usually go to nystatin quite early on for those reasons. And you can gradually see the tongue clearing off. Now here's bad news at the bottom. Candida behaves exactly like gluten in blocking absorption. So sometimes the person can go gluten-free and they're still not absorbing well. It's probably the Candida. There's some researchers from somewhere in Europe who just proved absolutely that Candida does the same damn thing that gluten does to the guts. So we really don't want any Candida down there, and we don't want any gluten down there for gluten sensitivity. Oh yeah, learned this one a while ago. You see all those little scallops in the edge of the tongue? Highly probably their tongue is swelling because of an allergic reaction, that's all. And so sticking into the teeth, and you can see the little tooth marks in the tongue. And occasionally it means hypothyroidism, but much more often it's just food allergies. We get rid of the food allergies, and we quit seeing the tongue with the teeth compressions into it. Oh my, check her CBC, check serum iron. Don't check ferritin. Ferritin is not iron. If you want to pay extra, please do. But if you just check the CBC with the serum iron binding capacity, and percent saturation, that's all you need. And if it's low, those are the things to consider. 1, does this person have low stomach acid? 2, could they have gluten sensitivity or hidden GI bleeding? And those are a couple of other things that have to be ruled out. But much of the time, making up for the iron, making sure the iron's absorbed, and the tongue isn't as pale anymore. Meow! Woo! There's a bright red tongue. Just happens to mean B vitamins, especially vitamin B2, are low in that individual. So we get those things into that individual, and what do you know? The tongue gradually improves to what most tongues look like. Now, some people lose taste sensation. That publication on the top from Japan, they told us that they had people use zinc picolinate, their taste disorder cleared away. So zinc picolinate is one thought. It happens to be also zinc picolinate, the zinc binding ligand for intestinal absorption of zinc. Oh, that's convenient. And that might be why other forms of zinc are not effective. It has to be the zinc picolinate. And every health food store, as you, I'm sure, all know, has zinc picolinate these days. And most of the manufacturers are doing the right job, and they're offsetting every 30 milligrams of zinc with 2 milligrams of copper, because I think we all know that if we took copper for a long time with no zinc, and we took zinc for a long time with no copper, they would cause a deficiency of the other one after a while. Now, there's this thing called tongue diagnosis. I happen to have a copy of that book at home. I'm not sure if it's still available at used book sources, but it's got some interesting things in it. I can't go through all of them with you, but there is a book on it. Okay, teeth and gums and mucous membranes here. Now, what if we got bad tooth decay? Oddly enough, one of the things that slows tooth decay down a bunch is strontium citrate. And it tells you there the quantities that work the best, and you can get that in health food stores and stuff. Well, smaller quantities help prevent bone loss. The larger doses can actually treat osteoporosis. You probably know that. So strontium citrate is one of the things that helps us to treat osteoporosis. Now, there are comparative studies with xylitol. It was found to prevent tooth decay better than fluoride. So why are we all being whacked over the head with fluoride? Well, I think I just complained about that a while ago. It's because the head of Alcoa Aluminum was appointed to some place in the FDA, and suddenly fluoride became legal. That's why. But this xylitol stuff prevents tooth decay better than fluoride. Maybe we should xylitolize our water supply instead of fluoridating it. Because the science is all there, that stuff's better, so at least we can use it on ourselves or our kids if we need to, because xylitol doesn't taste bad. Okay, gingival inflammation. Good old CoQ10 makes a difference. Folate as a mouthwash, also makes a difference. And oddly enough, D-mannose, and you know that word is illegal in Seattle, don't you? We cannot have a gender-specific ose. We can't have manose or womanose. That's illegal in Seattle. So we have to buy our D-mannose outside of Seattle. Fortunately, we're not in the city of Seattle. I'm sorry, they're just, all the voters and politicians in Seattle are crazy, but you probably know that. Okay, so the D-mannose powder stimulates gingival stem cells. So if you're ginging, if you need repairing, all you got to do is swoosh some xylitol, D-mannose, I got that wrong, some D-mannose from time to time, and there's the article on it if you want to look it up. It'll help those gums get better. Enhanced immunomodulation of periodontal ligament stem cells. Just D-mannose. Now, if they're pale, bleeding, and spongy, those gingival surfaces, it's always a lack of iron and C, those two things. And then they're no longer pale. So this is partly why a physical exam, when I first see the patient, if I've never seen them before and they have never seen me before either, I really do insist on doing as comprehensive a physical exam as I can, because you can pick up all kinds of signs of what's going on just from the physical exam. And you don't even need to run blood tests much of the time. Canker sores. Well, here comes food allergies again. You'll find there's some foods that have sodium lauryl sulfate added to them, and what do you know, they contribute to canker sores. The next thing, lactobacillus, iron, vitamin B12, and folate helps reduce the sores. Now, sometimes you see big tonsils in a teenager, and they're usually allergic to foods, and that triggers recurrent infection. And the same thing with getting rid of sugar, refined carbohydrates, and allergies. They do the same things. They reduce the irritation to the... Okay, miscellaneous dental research. Detrimental effect of gluten on tooth enamel. A possible explanation in the first article. Role of antibodies against gliadin in pathogenesis of, guess what? Enamel defects in celiac disease. So it's a really good idea to be getting rid of all the gluten, gliadin, and anything else from those sources. Okay, dental enamel defects in adult celiac disease, prevalence and correlation with symptoms and age of diagnosis. There's 2 nice publications on this. So we really should be paying attention to that if the tooth enamel is not doing as well as it should be. Now, I did forget the last paragraph. Half of the study group with gluten sensitivity showed no intestinal symptoms, but 85% had dental enamel defects. So we got to be watching for that. We don't have to have symptoms down here to have it affecting us up there. Okay, here's some oral manifestations of celiac disease. There's this article by Dr. Rashid who listed what they all were. Delays in diagnosis are common. Dental enamel defects and aphthous ulcers occur in patients with celiac disease may be the only manifestation of the celiac disease. When dentists inquire these features, they should inquire about other clinical symptoms, such as family history of celiac disease. Again, the citation's up there, and yes, you can go to PubMed, download the silly thing, and read it if you feel like it. Okay, here comes D. Manos again. Modulation of periodontal ligament stem cells. Citation down at the bottom. So, a lot of good things for swooshing D. Manos around our mouths. There was another previous slide or two for that. Okay, type 2 diabetes. I think it's just a type 2. Diabetes increases the risk of periodontal disease. Just what we don't need, is it? We don't need anything extra to go with our diabetes. Does periodontal disease affect glycemic control? As it says, it's less clear whether it does. So anyway, there is a relationship between diabetes and periodontal disease. And if you see unexplainable periodontal disease, I always ask, hey, is there any family history of type 2 diabetes here? Because it's usually type 2, not type 1. And there frequently is some family history. Okay, dental plaque inhibiting. Oil pulling therapy showed a reduction in the plaque index, modified genital scores, and the total colony count of aerobic microorganisms in the plaque. So there we are, effect of oil pulling, just with oil, on plaque-induced gingivitis, and that was a triple-blind study. Now, the patient was blind, the doctor was blind, who else was blind? But anyways, a triple-blind study. Now, this stuff in parentheses called glycyrrhizol A from licorice root has strong antimicrobial activity against carcinogenic bacteria. Use these extracts which they develop to develop a sugar-free lollipop that effectively kills carcinogenic bacteria. Would somebody who's a business person out there please pick up this information and put that on the market? Yeah, that'd be nice. Because there's studies on it that these lollipops led to a marked reduction of organic bacteria in oral cavity among most humans tested. And there's a citation. If your business would like to develop a lollipop that'll work against dental cavities, there you go. Okay, there's a bunch of traditional medicinal plant extracts that do have inhibitory effects. So I'm not going to read through the whole thing, but what the citation says at the bottom comes from evidence-based complementary and alternative medicine, and it gives you the whole explanation of which medicinal plants help against unbeneficial bacteria in the mouth. So our ancestors in healthcare, in Asian medicine and Chinese medicine, were just every bit as smart as we are, and they had a lot of time to work on it too. So they came up with some things that just come from Chinese herbs and Ayurvedic botanicals. And what do you know? They work on oral diseases. Okay. We've all heard of neem in the health food store. And they've got some people who use that neem. Results. Indica mouthwash is equally effective in reducing periodontal indices as chlorhexidine. Now, chlorhexidine, as far as I'm aware, is a molecule never found on planet Earth until somebody was stimulated to get a patent on it. So they did. But this here says, I don't know how to pronounce that, Azadirachta India, otherwise called neem, is just as effective as chlorhexidine. And neem has been in Ayurvedic medicine for how long? Oh, a couple thousand years, maybe 1,000 years, I don't know. Okay, now quercetin, here we are again, goes against a lot of periodontal pathogens. Effective on several oral microbes. No colony-forming units of Their PG stuff here, periodontal pathogens, could be observed after 24 hours. That's pretty neat. Quercetin clearing out all the oral pathogens in 24 hours? Well, that's one of many reasons why a lot of us take quercetin every day, maybe even twice a day, because quercetin seems to do a whole lot of good things in our bodies, and the only adverse reaction I have seen ever was somebody who unfortunately had a whole bunch of allergies, and yeah, they were allergic to quercetin too. But what we could do for that particular individual, that lady, is desensitize her to quercetin, because we know it's a safe molecule in most people's bodies, so she would just do some desensitization, which we did, and then she could swallow the quercetin. She had no trouble. So just because you're allergic to something doesn't mean you totally have to avoid it. You can get things desensitized too. So, quercetin, antimicrobial. Licorice, what do you know? Licorice and its components up there possess potential beneficial effects in oral diseases. Now that's going to make licorice lovers happy. I'm going on down to the health food store, get me some licorice here and help keep away oral disease. The citation is down at the bottom. And here comes resveratrol. That stuff does all kinds of good stuff. Quercetin, resveratrol, inhibits periodontal pathogens. Oh my goodness. Okay, and they give you all the reasons on there, and there's the citations at the bottom. And let's see, 1727, I doubt that's 1727, but anyway, now there's 2011 up at the top. So anyway, that's not that old. And yeah, it does work. I have a lot of people use resveratrol and quercetin, and they do a lot better orally. Of course, a lot of other things will do better too. We all know that. Now, there's this stuff called naringin. Yeah, if I can pronounce it right. Naringin, a flavonoid in grapefruits. So they're investigating the growth of periodontal pathogens. And what do you know? Significant antimicrobial properties on periodontal pathogens. So if you can convince your patients to eat grapefruit on and off, that's going to be good if there's oral problems. And moving along to lips. Those cracks at the corner of the mouth, if they're there, can almost always be cleared up by B-complex, B2, and iron. I think we might have covered that before. Then there's good old cold sores and herpes. Now, probably everybody's well aware of this, but you cut back on your arginine, which unfortunately is included in chocolate, nuts, seeds, and beans, and you don't get as much herpes, but you got to cut back on arginine. If you eat more arginine and less lysine, you get more herpes breakouts, which of course leads everybody to ask, can I prevent herpes breakouts and still take 3 grams of arginine because it does good for my erectile dysfunction? Can I take just as much lysine so that I won't get a problem? Well, that does work for some people. They'll take a little bit more lysine than arginine, and the arginine still works, and the lysine prevents troubles. And they're both good for us anyway. Okay, other things that help against cold sores: selenium, low-dose lithium. What's low-dose? 5 milligrams, 10 milligrams, not a prescription of 250 or something. And then here we go with Ayurvedic medicine again, but or Asian medicine, Lauria. That's more for treatment. And for symptoms, this is just a repetition of a prior PowerPoint. Glycerinic acid, it helps against symptoms. Now, it's just a symptom reliever, though. You want to use some of the things above to get rid of the problem itself. Now, parotid duct stones. This is something that I had a patient try early on back in the 1970s. He had a big old parotid duct stone, and I happen to know that iodine helps dissolve stones in the kidneys. Yeah. So I asked him to get some potassium iodide. The parotids do concentrate and secrete iodine, 6 drops in water daily. It takes 6 months or more to get rid of a parotid stone, but you can do it with the iodine. And pretty obviously, we want to keep our eyes, as it were, on the thyroid gland with a blood test before and a blood test down the road, and make sure we're not affecting the thyroid adversely by the iodine, but it sure does affect the parotid stone adversely. And monitor thyroid. Now that one is so simple. It's like recurrent anything. Get rid of the food allergies. Get rid of the sugar and refined carbs. We all got to remember the first humans on this planet couldn't eat sugar and refined carbs. Excuse me, they simply couldn't. No sugar cane grew where Adam and Eve hung out. They just couldn't get sugar. They couldn't get refined carbs. Eliminate food allergies, which can be part of the reaction there, and then use zinc and vitamin A. How much? Well, zinc comes in at 30 milligram with 2 milligrams of copper, and I'd be using one of those twice a day. And the vitamin A, remember, it'll give you a headache if you use too much. So I go up to those university levels if I'm just starting out, and that's 50,000 IU for the men and 40,000 for the women. And if you get a headache, it's too much for you, but if you don't, and it takes this problem away, okay, then after the problem's gone, you can try cutting back and see if it stays away. This one's so simple. Recurrent strep throat, the milk and dairy have got to go. It really, really triggers strep throat. Now, people with that history of strep throat have elevated IgG antibodies to milk and dairy, even decades after the last strep throat. Decades after. So if they have a little bit of milk here and there, they're going to have antibodies. And it's 100% effective, by the way, for recurrent strep throat. Just gone. Get rid of the milk, get rid of the dairy, it's gone. Now, there's this book called Don't Drink Your Milk by the director of the pediatrics department at Johns Hopkins. That's a little bit prestigious, isn't it? And he put out this book called Don't Drink Your Milk, which I bought several copies of and gave it to all the doctors in the clinic, including me. And everybody quits getting recurrent strep throat if they quit drinking milk. Pretty simple. Swollen glands in the throat and tongue. And kids get those when they're coming down with a cold or a flu sometimes. Sometimes they get swollen. You can't look for a reason. But it's almost always an indication of food allergies. So we want to check those kids for food allergies. We're getting there. Ooh, there's some robust shoulders there. Now, clavicle. One of the things Dr. William Kaufman, there's his name at the bottom, taught us all that area is supposed to be convex. If you see concavity that goes above the clavicle, that person's got a problem. It's supposed to be convex. They're not getting enough niacinamide. Here we go back to Dr. Kaufman and his niacinamide. So if you're doing a physical exam and you see somebody with a convexity here, that's a sign of not enough niacinamide. Okay, now niacinamide, I keep talking about it because Kaufman found it does so many things. A total of 3 grams a day. I rarely run into anybody who gets nausea, low grade, on 3 grams a day. And we try to have them spread it out, and very nicely, there's now time-release niacinamide, so take one in the morning, one at night, you don't have to spread out the single tablets. But I warn everybody, if you go past 3 grams a day, and if you get any inklings of low-grade nausea, you got to back off. Because that is just our body saying that's too much niacinamide for me, thank you, or not thank you, whichever it is. And again, that comes from Kaufman's book, The Common Form of Joint Dysfunction. And yes, I am going to repeat it because it isn't applied enough. Kaufman reported on 354 cases of osteoarthritis, 350 of which were vanished within 3 to 4 months. All it takes is niacinamide in adequate doses. Okay, what about bursitis? Well, funny thing, if anybody gets bursitis, it's a sign of B12 insufficiency. And you don't inject them with B12 into the bursa either, just into the body anywhere. Oral administration doesn't help very much, but you inject the stuff, and what do you know, the bursitis goes away. You do it every day till the bursitis goes away, every other day till the bursitis goes away, doesn't matter. And of course, it's always almost accompanied by low gastric acidity, because if the stomach isn't making enough of the combining factors to bring in the B12, then it's not making acid either. I know I've said that several times, but that's the case. Okay, frozen shoulder. Now, George Eby down in Texas, elimination of arthritis, pain, and inflammation for over 2 years with topical gallium nitrate for 90 minutes. Case reports and review of gallium number 3. So if you want to look that one up, you can download it from PubMed. And gallium is available, no question. And George Eby, who is still with us, if you got any questions, would love to hear from anybody, because this is his treatment. It works. I use it at our clinic, and it just needs that gallium. Topical, not swallowed. Greatly reduced pain and crepitus, almost immediately, complete restoration of range of motion. The only reason this isn't used in conventional medicine, it's that effective, we all know what that is. You cannot patent gallium. It's a natural molecule. Okay, rough, bumpy skin in children and teenagers. We go back to vitamin A and carotenoids, and of course, check to make sure they don't have gluten sensitivity. Same thing for adults, but there's more than that. Check the pancreatic exocrine function. You really got to, because adults who get rough, bumpy skin, they're frequently not making enough of the digestive enzymes to do the job as they did when they were younger. So anyway, check the pancreatic exocrine function. There are a number of laboratories. You can send in a stool test, and they'll check and see what's being digested and what isn't digested and send you the results back. And when we do send one of those in, which we don't, we give people the choice of just get onto your pancreatic enzymes and do that. Or if they want to be tested to make sure they need to, okay, you can send a stool test to many labs to see if the pancreas is doing its exocrine function job. Okay, you also want to check for thyroid function because it helps transform beta-carotene into vitamin A. So, 2 things I should have said: pancreatic exocrine function, and we want to check thyroid function. Chronic hives, arms, legs, and anywhere. Now that one is simple. It is so simple, getting rid of hives. We've done it for everybody who's come in since I read all about this. There's an endocrine handbook by Henry Harrower from 1939. I don't know if you can find it, but it does exist. We've been eliminating chronic hives in 100% of everybody, no kidding, with injections of cell therapy. Now, cell therapy was put together by Dr. Paul Nihans over in Switzerland. What he did was to use fetal animal cells. I am not kidding you. Fetal animal cells. There's a whole book out there by Paul Nihans. If you want to look that name up, you can read online all about Paul Nihans, N-I-E-H-A-N-S. And what he found is that if you happen to have a weak organ, let's take the person we were working with who is needing a blood transfusion every week because his bone marrow didn't work anymore. And he'd been on blood transfusions for a couple, 3 years, and he didn't want to stay that way because here he was in with his son. His son was a 40-year-old something, and the father was a 65-year-old something. And the father wanted to go back to China where he was born, but he couldn't because he couldn't get a blood transfusion every week out over in China. He checked into that. He couldn't do it. So what did we do? We ordered bone marrow cells. Previously, we could order them from Switzerland, where Nihans' company was. But then the Swiss authorities, so-called, and the American authorities at the Federal Dumb Apartment, or whatever it's called, FDA, the American authorities ganged up. How they got together to gang up in Switzerland, I have no idea, but they did. And they drove Nihans therapy out of Switzerland. But you can't order it from Southeast Asia. Yes, you can. Southeast Asia. So if you need any more information on that, call my medical assistant at Talma Clinic, okay? Or you can read the book by Paul Nihans. It's called Cellular Therapy. And you can find that one used too. Cellular Therapy, Paul Nihans, N-I-E-H-A-N-S. Now this endocrine handbook, back to Harrower's work, that one told us if we use spleen and thymus in the form of cell therapy, we could get rid of hives. And so far, it has been effective in 100% of cases since the 1970s. Here's one shot of thymus, here's one spot of spleen. If that doesn't totally clear it up, use another one of each, and your hives are gone. Apparently, what the cell therapy is doing is helping the thymus and the spleen to work better, that's all. Okay, it's very safe, but it was illegal until the DSHEA legislation of 1994. So now you can use it again. Just amazing how people who don't know anything about working with patients are able to dictate what all of us do. Amazing. Dry flaky elbow skin, really pretty simple. Fatty acids, mixed tocopherols, and it's a big complex. Or go eat more food with those same things in them. Psoriasis is caused by an autoimmune reaction to Helicobacter pylori. So if you've got somebody with psoriasis, check those Helicobacter pylori antibodies. Almost every case I've checked, the Helicobacter antibody levels have been high. Sorry about that. So we got to go after the Helicobacter pylori if we find positive antibodies. And there's 2 articles there on clearance of chronic psoriasis after eradicating H. pylori, and another one on plantopalmar psoriasis through eradication therapy. Now, what can you eradicate Helicobacter pylori with that's safe for humans? Never's done any harm. There's a product out there, and I don't work for them, and they pay me no money. It's called Psorazide, P-S-O-R-A-Z-I-D-E. P-S-O-R-A-Z-I-D-E, Psorazide. Psorazide was put together by Dr. Smith, who found that Helicobacter, he went to the Black Sea, by the way, because a lot of people's Helicobacter got better there. So he analyzed the water. He found it was full of boron. Not high levels, doesn't hurt anybody, but it was higher than usual water. Helicobacter love boron. So the Psorazide is simply nickel dibromide. And the Helicobacter, once it's dissolved in the intestines, the Helicobacter take up the nickel. That's what they love. Smith determined that by going to the Black Sea and testing it and found out a lot of nickel in the water there. No kidding. A lot of bromide too. But the bromide part kills the Helicobacter. So anyway, this product called Psorazide, no, they don't pay me anything. I just treat patients with it. P-S-O-R-A-I-Z. Psorazide, P-S-O-R-A-Z-I-D-E. It's gotten rid of just all the Helicobacter treatment, Helicobacters that I've treated. Other treatments for psoriasis, you're all going to get copies of the PowerPoints, and I'm told I better shut up fast, so I just want to let you know that they exist. Here's another set of treatments. Tennis elbow, hawthorn of all things. Yeah, give them hawthorn. They don't get tennis elbow as much. And for women under 40, if they're low on DHEA, they're much more prone, or supine, whichever it is, to low DHEA levels. And you get those DHEA in there, that DHEA in there, and you can get it from any compounding pharmacies as a rub-in, and they quit losing as much hair. Same thing here, DHEA. Okay. Now, you're all going to get a copy of these PowerPoints. We're out here to 111 or something like that, I don't know. And I'm told it's time to shut up, isn't it?
Let's give Dr. Wright one more round of applause. I don't need to cut it off.
Thank you, ma'am.
Thank you so much.
Welcome.
We have an awards banquet, that's why we can